Hello everyone, my name is Adam and I'm one of the audiologists at Alto Hearing, and we are back today to bring you another earwax removal video from our clinic in Lutterworth, UK. If you do enjoy this content, then please hit that like button and subscribe to the channel. We really do appreciate your support. So today, for this first part, I want to talk about retraction pockets. I don't know if you've heard of this term before, but basically it's when you get a sort of abnormal inward bulge in the eardrum. So a normal eardrum is quite a smooth surface, and occasionally we see these retraction pockets appear, and they occur for a few different reasons. Sometimes it can be because of negative middle ear pressure, so Eustachian tube dysfunction that can lead to the pressure inside the middle ear being lower than the external atmospheric pressure, and that causes the eardrum to be sort of pulled inwards. That's the most common reason, but sometimes it happens just because of persistent inflammation and infections and things like that. So now the big concern with these retraction pockets is cholesteatoma. So with this one, it caught Maria's eye, and so what she does is she performs something called the Valsalva manoeuvre, and that's when you hold your nose and blow, and this temporarily increases the pressure in the middle ear. It's not a definitive diagnostic tool, but you can see here that it gives us the evidence to support the suspicion of a retraction pocket, and that enables us to give as much information as possible for an onwards referral. So when we're in clinic, we come across a variety of different looking eardrums, and especially at this time of year when it's winter and there's a lot of colds and other viruses floating around, you tend to get quite a lot of them actually. And with this next one, Mariia takes quite a large chunk of earwax out here. It looks quite dry, but it's removed quite easily. And then it's just a case of clearing up a little bit of the rest of the skin. These bits can be a bit tricky, as they can sometimes make that loud noise. I think Connor from Durham refers to it as clarinetting, which is a nice way of putting it. It basically means it gets super noisy for the client, so you have to be really careful here. But if you can just see at the back there, look at that eardrum. You've got a tiny little air bubble in it, and well, there's a few of them actually, and it is quite unusual. Now, when we see this, it's normally just air bubbles in fluid, also known as effusion, that is collected behind the ear. If there's any Eustachian tube dysfunction, it can cause fluid to collect behind the middle ear. It's possible that there could be little retractions, but again, Mariia instructs the client to do the Valsalva manoeuvre, and we can see here that these air bubbles aren't moving themselves like the previous one. The whole eardrum is moving. So this is probably the after effects of a bit of an infection. We'll get this gentleman referred over to his GP, and I'm sure they'll be able to help him with this. So that's it for today. We've got some more really interesting cases coming up. Again, if you do enjoy these videos, we'd really appreciate it if you can subscribe to the channel. We'll see you again very soon.